Stop scrolling right now. I need you to stop whatever you are doing and watch this entire video, because what I am about to share with you could literally change your life or the life of someone you love deeply. The Senate just passed the Elder Care Bill, and I am going to tell you exactly what is in it, what it means for your wallet, your health, your dignity, and your future. In plain English that anyone can understand. No political spin, no confusing legal language. Just the truth, broken down for you because you deserve to know. And here's what makes me angry. The mainstream media spent about 4 minutes covering this story before moving on to the next celebrity drama. 4 minutes. For a bill that affects over 57 million seniors and retirees in this country. Millions of families who are quietly struggling, quietly sacrificing, quietly choosing between groceries and medication. And nobody is explaining what this bill actually does for them. That ends right now. Let us start with the very first thing that probably keeps you up at night. Prescription drug prices. If you are on Medicare and you have watched your drug costs climb every single year, you already know this pain. People with diabetes paying over $300 a month for insulin. Heart patients rationing blood pressure pills because they cannot afford a full prescription. This was the reality for millions of Americans, and it was shameful. The Elder Care Bill changes this in a significant way. Under the new provisions, Medicare is now empowered to negotiate directly with pharmaceutical companies on an expanded list of high-cost drugs. What does that mean in real dollars? Experts estimate that seniors could save between $800 and $4,000 per year, depending on their medication needs. The out-of-pocket cap on Medicare Part D is also being strengthened so that no senior will pay more than $2,000 per year on covered prescriptions starting in the next enrollment cycle. That is money that stays in your pocket. That is money for food, for utilities, for your grandchildren. Now let us talk about Social Security, because this is where things get really important and where most people have been left completely in the dark. For years, certain retired government workers, teachers, firefighters, police officers were penalized by two provisions called the Windfall Elimination Provision and the Government Pension Offset. These rules slashed Social Security benefits for people who spent their entire careers serving their communities. It was unfair. It was wrong. And the Elder Care Bill finally addresses this injustice. If you or your spouse worked in a government job and were receiving a reduced Social Security benefit because of these offsets, you need to contact the Social Security Administration immediately. This is not automatic for everyone. Some people will need to reapply or update their records to receive the corrected benefit amount. Do not wait. Call the SSA or go to ssa.gov and find out if you qualify for a higher payment. For some households, this correction means an extra $300 to $500 every single month. That is not nothing, that is life-changing. Let us move to nursing homes and long-term care, because this section of the bill is one that every family with an elderly parent needs to hear. The horror stories from nursing homes across this country are not new. Understaffed facilities, residents left in bed for hours, food that does not meet basic nutritional standards, families who paid enormous amounts of money expecting dignity and receiving neglect. The Elder Care Bill creates new mandatory staffing ratios for Medicare and Medicaid-certified nursing homes. This means there must be a minimum number of trained staff on the floor at all times. No more skeleton crews on weekends and nights. Facilities that fail to meet these standards will face financial penalties and public disclosure. That last part matters. For the first time, inspection results and staffing records will be published in a searchable public database so you can look up any nursing home before you place a loved one there. This is transparency that families have been begging for decades. Now here is something that does not get nearly enough attention: home care and aging in place. Most seniors do not want to go to a nursing home. They want to stay in their own house, in their own community, surrounded by what they love. But home care is expensive. Aides, nurses, therapists, the costs add up fast, and Medicare has historically covered very little of it. The Elder Care Bill expands home care coverage under Medicare, adding more covered hours for qualifying seniors who need help with daily activities like bathing, dressing, and meal preparation. There is also a new grant program for home modifications, things like wheelchair ramps, grab bars, and walk-in showers that can help seniors stay safely in their homes longer. These grants can cover up to $10,000 in modifications, and they are available through your local area agency on aging. You need to apply. This is not automatic. Call your local agency or go to eldercare.acl.gov to find the office nearest to you. Now I want to talk to every adult child, every spouse, every grandchild who is quietly acting as an unpaid caregiver for a senior loved one, because the elder care bill sees you too. There are over 53 million unpaid family caregivers in America. People who gave up promotions, sleep, social lives, and their own health to take care of someone they love. The system has ignored you for too long. This bill includes a new caregiver tax credit. If you are providing care for a dependent parent or senior family member, you may now qualify for a credit of up to $2,000 on your federal taxes. Additionally, the bill expands access to respite care, temporary relief services that give caregivers a break through Medicaid programs. If you have been running on empty, help is coming. Talk to a tax professional about claiming this credit when you file, and contact your state Medicaid office about respite care options in your area. Now, I have to stop and give you a very serious warning, because every time the government announces a new benefit program, the scammers come out like vultures. They are already out there. Right now, people are getting phone calls, text messages, and emails telling them they need to act immediately to claim their elder care bill benefits. They are being asked for their Social Security number, their Medicare number, their bank account information. Listen to me very carefully. The government will never call you out of the blue and ask for your personal information to enroll you in a new benefit. Never. If someone calls you claiming to be from Medicare, the Social Security Administration, or any government agency and asks for your information or asks you to pay a fee to access your benefits, hang up. It is a scam. Report it to the FTC at reportfraud.ftc.gov. Talk to your family members, especially those who live alone, and warn them. These scammers specifically target isolated seniors, and they are ruthless. Please protect yourself and the people you love. Let me quickly summarize what you need to do right now. First, check your Medicare Part D plan during the next open enrollment period, typically October 15th through December 7th. And look for the lower cost options that will reflect the new drug negotiation savings. Second, if you or your spouse worked in a government job and believe you were affected by the windfall elimination provision or the government pension offset, contact the Social Security Administration today at 1-800-772-1213. Third, if you or a loved one is in a nursing home or considering one, visit Medicare's Nursing Home Compare tool at medicare.gov to check the facility's staffing ratings. Fourth, if you need home modifications or home care services, contact your local area agency on aging through eldercare.acl.gov. Fifth, if you are a family caregiver, speak to a tax professional about the new caregiver tax credit before your next filing. Here is what I want you to hold on to as we close. You worked your entire life. You paid into these systems, you raised families, built businesses, served your communities, and contributed to this country in ways that can never fully be repaid. You earned every single benefit that is coming your way, and you deserve to receive it with dignity. This bill is not a handout. It is a recognition of your worth, your sacrifice, and your right to live your later years with security and peace of mind. Do not let the system confuse you into not claiming what is yours. Do not let the complexity discourage you. Do not let the scammers steal from you. And do not let the media's silence make you think this does not matter. It matters enormously. You matter enormously. If this video helped you, I am asking you to do one thing right now. Share it. Share it with your parents, your grandparents, your neighbors, your church group, your senior center. There are people watching television right now who have no idea that their lives just got a little bit better, and they will never know unless someone like you tells them. Subscribe to this channel because we are going to keep covering every update, every deadline, and every benefit that affects seniors and retirees in this country. Hit the notification bell so you never miss a video. And if you have questions, drop them in the comments below. I read every single one. You deserve to know. You deserve better. And we are going to make sure you get it.